of Peace Hospital have been assessing the progress registered so far by authorities. This as the international countdown on the Millennium Development Goals begins. Ibrahim Balde has that story.
For Sabtu Suwane and her colleague nurses at the Jammeh Foundation for Peace Hospital in Bundung. The peak periods are usually during weekdays when the demand for healthcare is ever challenging. With 2 years to go before world leaders reconvene with a view to looking critically at the progress registered, we went out and about to gauge the reactions of the health workers about the UN MDGs.
As far as we are concerned here in Jammeh Foundation, we are working towards achieving the Millennium Goal 4 and 5, which is the reduction of maternal and neonatal death. Yes, at the moment, there are ongoing trainings, there is capacity building, ongoing training on infection control, care of the newborn, maternal emergencies. We're doing all that to try and find ways of cutting down on maternal death and neonatal death. So there is that ongoing training going on amongst us here in the hospital. And sometimes the ministry they do organize workshops based on those training as well, maternal and neonatal child health. They are doing that to see that we achieve Millennium Goal 4 and 5. So we are working towards that, and we hope to achieve it by the year 2015.
Optimism is the buzzword here, and Satu added that a lot has been done, arguing that she was optimistic about our commitments to achieving the UN MDGs.
We're working towards achieving MDG 4 because our maternal death rate has reduced, neonatal death rate is going down because of the ongoing trainings, commitment, and the like.
The Gambia has over the years witnessed unprecedented developments in the health sector. With the Dongoroba Health Center in focus, many believe the more the merrier. Sabtu added that the construction of health centers in rural communities would undoubtedly help ease the pressure from patients who travel to the city for medical treatment.
So with the increased number of health facilities in these villages and catchment areas, it will go a long way in reducing the workload here, because instead of patients coming all the way from Foni with health problems, they can be rather seen at their various facilities. If they cannot manage those conditions or health problems, they can be referred to major health centers or hospital, the main referral hospital, Banjul. Or Brikama, even Brikama, they are doing operations now. So it will go a long way in cutting down the workload here.
MDGs are the most successful global anti-poverty push in history.
At the United Nations, Secretary General Ban Ki-moon's statement is meant to spur member nations to move faster and deliver on their promises to reduce poverty and improve the health conditions of the peoples.
World poverty has been cut in half. More girls are in school. Child mortality has dropped. We are fighting killer diseases. The list goes on. But too many women still die in childbirth when we have the means to save them. Too many communities still lack access to sanitation. Too many families are still being left behind. We have 1,000 days to close the gaps, 1,000 days to accelerate action. Here are 4 ways to step up our efforts. First, scale up success through strategic, targeted investments in health, education, energy and sanitation. Above all, by empowering women and girls who can boost results in all other areas.
It's not going to be easy, however. With hard work, these goals could be met even before 2015. Well, normally hospitals in sub-Saharan Africa are almost overstretched with the sheer number of people who on a daily basis knock on their doors to receive treatment. The situation might not be as different from that of Jammeh Foundation for Peace Hospital, where we understand the numbers are also increasing as a result of the services being provided here. The good news is that the nurses here are also optimistic about the chances towards attaining the Millennium Development Goals, which concerns health. Ibrahim Balde reporting for GRTS at the Jammeh Foundation for Peace Hospital in Bundung.
A staggering 860,000 people die of malaria in Africa. We examine how malaria remains #1 killer disease on the continent. We'll be back with these and other stories right after this break. Welcome back. Efforts to fight or contain malaria are showing no signs of relenting. Around malaria endemic regions, especially sub-Saharan Africa, where thousands of people die as a result of malaria-related illnesses every year. As we hear in this moving documentary entitled Fighting Malaria, focus is on the colossal sums of money being spent to rid the continent of malaria.
Caused by a parasite, a tiny, single-celled organism in the blood vessels and livers of human beings. It's a serious disease that disables and kills more than 860,000 people every year. Though 40% of the world's population live in malaria endemic regions, the majority of related deaths occur in sub-Saharan Africa. Despite medical advances, the disease continues to be a problem. It is estimated that every 45 seconds, a child dies from malaria in Africa. But there is hope that one day malaria will no longer burden the people of Africa. Angela and Regina both have daughters infected with malaria. These mothers have come to the Shampande Clinic in southern Zambia to receive medication. Supplying effective drugs within Africa is a challenge. Regina and Angela desperately hope to find treatments for their suffering daughters.
Children are one of the most vulnerable population to malaria. As you know, in many parts of Africa, people do not easily access drugs in the public sector. They would have to walk miles before they find a public structure.
One of the biggest problems in Africa is lack of health education, which can lead to a lack of malaria diagnosis and treatment. Every year, the continent loses an estimated $12 billion in gross domestic product due directly to the disease.
What we are facing is not just a lack of drugs, not just a lack of nurses, a lack of an efficient distribution system. It is fundamental in the health education, the education overall, but the health education of people, and then make sure people get access. Drugs are available, but they need to reach the patients.
With inconsistent availability of treatments, mothers like Regina and Angela can only wait and hope for the arrival of effective drugs for their daughters.
It is essential that children are helped being prevented from getting malaria by having them sleep under bed nets. If a child is sick, they would need the appropriate drug that is adapted to the body weight of the child.